Hi everyone, my name is Dr. Robin Lewis. I'm a naturopathic physician practicing here in Vancouver, British Columbia. And today I want to talk to you about one of my favorite topics. So we all know that in the pursuit of health and wellness, people will do some pretty wild things. This is one of those wild things. Over recent years, cold water therapy has become very popular. So I'm sure we've all seen our friends and family getting into ice baths, dunking into frozen lakes, oceans, rivers, all in the pursuit of good health. Well, today I'm going to talk to you about how this fad is actually quite legitimate. There are a ton of good health benefits from a physical and mental standpoint. And today I want to break that down for you and how you can practically incorporate cold water therapies into your day-to-day life so you can really reap those benefits. One of the main reasons cold water therapy is effective is because it creates what's considered a good stress in your body. So what I mean by that is there are good and bad stresses on the body. Another example of a good stress would be something like exercise. We create stress in the body and our body will adapt in a way that is healthy. So you can think of cold water therapy similar to exercise. We are creating discomfort. We're not going to like being in that cold water therapy. It's going to shock and stress our system. It's really the adaptation that happens as a result of this stress that we're looking for here. When that cold water hits the skin, it'll cause a rush of adrenaline hormones like norepinephrine. Our heart rate will increase. Our breathing rate will increase. All of this puts us into a state of stress. If we can learn how to remain calm during this state of stress, that's really the adaptation that we're looking for. So as you can imagine, this plays out in a lot of different ways in our life. So say, for example, we're going to a board meeting where we have to present, or you're in rush hour traffic. It is of benefit if we are able to stay calm in these stressful situations. Our brain will think better and we will perform better if we are not allowing stress to take over. So really that's the idea with cold water therapy. And as you can imagine, this relates to a lot of different areas of our life because a lot of things are stressful. But I do want to break down for you a couple more specific areas of our health that cold water therapy is really known to help. I'm going to start by breaking it down into physical benefits and mental benefits. I won't have time to go over everything, but I do want to give you the highlight points. So from a physical standpoint, it increases our metabolism and can help with regulating our inflammation. From a metabolic standpoint, there's really two key mechanisms at play here. The first one is fairly obvious. When our body temperature starts to drop, our metabolism needs to rev up in order to produce energy to protect our vital organs from becoming too cold and therefore shutting down. The easiest way to think about this is if you relate it back to exercise again. So when we're burning a lot of calories, we're hitting the weights hard, we're going for a really long jog, our internal energy starts to rev up because we're burning a lot of energy off and that is released as heat. So in response to cold, our body is going to do something similar. Now, if that was the only benefit, the increase in metabolism would probably be very temporary and it wouldn't really be that impressive. But there is this second function that cold water therapy can have on the body that can more likely explain more of the long-term effects on metabolism. And that is the transition from white fat to brown fat. So white fat is the fat that we're more conventionally used to. So that's our storage. We put all of our excess calories in the form of fat into these storage pools of white fat. Brown fat, however, is much more metabolically active. So it actually contributes to our resting metabolic rate up to 5%. So obviously, if we can have more brown fat relative to white fat, theoretically, our metabolism would go up. And that is what cold water therapy is supposed to do. In adaptation to the cold, we start shifting our fat cells to a more favorable, metabolically active type of fat. So those are the two main reasons that cold water therapy on a regular basis can be super helpful for at least creating a healthy metabolic rate. It doesn't necessarily mean that you're going to lose a ton of weight by just doing cold water therapy, but it's going to at least put your metabolism into a healthier place to begin with. From an inflammatory standpoint, the benefits aren't quite as obvious, but there can be some improvements to inflammation that people will note with cold water therapy. If we're talking anecdotally, a lot of my patients, and I have even experienced this myself, I feel a lot less joint achiness and stiffness if I'm engaging in regular cold water therapy. And there is some research to support that it can have an overall healthy effect on inflammation and on your immune cell function. If we dive a little deeper, one of the main reasons for this could be the improvements to mitochondrial health. So the mitochondria are the part of our cells that create a lot of energy. In fact, they create the majority of energy currency inside of our body. And with age and a lot of different exposures, our mitochondrial health can begin to decline. Well, cold water therapy has been shown to increase what is called mitochondrial biogenesis, which means the formation and the repair of new mitochondria. So in that regard, if our cells have more energy, they can certainly carry out their functions more optimally. So that might be one of the reasons why some people will notice a drastic improvement to their overall feeling of inflammation, and in some people, an improved immune cell function. If we want to now talk about some of the main benefits that cold water therapy has on our cognitive mental state, then I'm going to break it down into two main categories. Not comprehensive, not every potential mechanism, but I believe these are two of the key areas of which this therapy can help with your mental cognition. The first one has to do with dopamine. So dopamine, which is our pleasure, memory, addiction, motivation neurochemical, dopamine levels will increase in response to cold water therapy. And some studies have seen that that increase can be upwards of 250% what our normal baseline of dopamine is. So this is not an insignificant increase in our dopamine levels. So this is likely why when you have your cold water therapy, so say you have a cold water shower first thing in the morning, you will feel energized and you will have just a sense of feeling good for the rest of the day. This is without a doubt the number one thing a lot of my patients will say to me when they start doing cold water therapy. I feel much more alert, I feel more resilient, and I just feel like I can handle the day a little bit better. So dopamine is a big player when it comes to this, and our levels can go up significantly if we're doing cold water therapy. Some people are even using cold water therapy to come off of addictive substances like cigarettes, because a lot of these addictions are dopamine driven, which means if you take a puff of that cigarette, it will spike dopamine in your body, and that's the sense of feeling good once you take a little bit off of that cigarette. And so we're trying to recreate this feeling of good with something a little bit better for us, which is cold water therapy versus cigarette smoking. And there are incidents where people will use cold water therapy as a way to kind of compensate for that loss of dopamine that you will be getting, making it much harder to come off of those substances, which is super interesting and very cool to think that something as simple as cold water showers could be helpful for overcoming really challenging things like addictions. The second key function that I think explains a lot of the mental health benefits of cold water therapy is its effect on something called our vagal nerve, which is one of the most important talked about nerves in our entire body. Really, one of its key functions in the body is determining whether or not we're in fight or flight or rest or digest. In other words, we have two different modes to our nervous system. We have sympathetic, which is the fight or flight stress type of state, or we have the parasympathetic, which is our rest and digest calm state of our nervous system. And so when we have cold water therapy, it sends our body into a state of sympathetic drive. So the norepinephrine, adrenaline hormones will surge and our heart rates will go up, and all of those things point towards a sympathetic response. So for many of us, we're stuck in this sympathetic stress state because life is hard. We aren't sleeping appropriately. We're putting too many things on our plate. We're not handling stress as good as we could. And we become less and less efficient at winding down into our parasympathetic nervous system. So cold water therapy, by shocking the system and having that reflexive relaxation, will really help improve this. And you can see this when you measure things called HRV, which is our heart rate variability. Our heart rate variability should be high, meaning we adapt to our environment. So when shit hits the fan, we're able to get it going, get things accomplished. And when it comes to the evening time, we're able to actually unwind, fall asleep, and recover from the day. So we want a high HRV, and cold water therapy has been shown to improve our HRV scores, which is yet another way of proving that it's really healthy for our nervous system, more specifically our vagal nerve tone, which will dictate how good we are at flipping in and out of these situations. All right, now let's talk about how to actually do cold water therapy, because I keep saying this word, but I haven't really explained to you what that exactly looks like. So it is essentially the application of cold water. So that could mean an icy cold shower, dunking in a bucket that you have, an ice bath, something of that nature, going out into the wild and finding a icy lake that you can hop into, a very cold river, the Pacific Ocean. Really, the body of water doesn't matter. What we're trying to do is create enough of a shock from the cold that we get this beneficial response. So of course the temperature can really matter. But what I'm going to encourage you guys to do in the beginning is just go to your tolerance. Because even though you could do an ice bath, and there's lots of good evidence to show that the ice bath can be helpful over time, you also want to ease into this. So not everyone is going to start that way, especially if you're feeling particularly run down. Because as I described earlier, it can increase your heart rate, your respiratory rate, your stress response. So if your body's not really ready for that, or if you go too hard too quickly, you could have a negative consequence. And this is not something that you just do for long periods of time. Of course, if you're sitting in cold water, there is a point in which this is bad for you and can lead to things like hypothermia. So I really encourage you guys to start small, start at a cold temperature that is tolerable, that you could hang out in for a couple minutes, because consistency is key. So if it's absolutely painful, you're probably not going to do it again. You will get benefit even from a moderately cold shower. There is good evidence to support that it does not require the most extreme cold temperatures. And realistically, it's about how often you do it. Anything like exercise, if you just do it once, it's not going to really do much in the body. But if you can be consistent about it, that's when you're really going to notice the benefits. As far as how often to do it to see those benefits, they have looked at this, and roughly speaking, you want to be doing at least 10 to 15 minutes a week. Usually not all at once. So you break that up into chunks. So maybe you're doing 3 minutes 4 times a week, as opposed to one big, long 10 to 15 minute session. And for most people, they will notice a big benefit from just 10 to 15 minutes a week. So this is not something that you have to commit hours and hours and hours to. And in fact, I'd probably encourage you not to do hours and hours and hours in the cold, because that's usually where you get into the downside of these therapies. But yeah, just 10 to 15 minutes a week. It could be 3 minutes at the end of the shower. That is enough to start building resilience inside of the body, improving our reaction to stress, and really get a lot of these health benefits out of cold water therapy, no matter what form you're trying to do. To be more specific, anything below 15 degrees Celsius is technically cold water therapy. So for a lot of people, 15 degrees Celsius isn't really that cold. And yes, of course, as you go on, I do encourage you guys to push past 15 degrees Celsius, but it really can be as little as that to begin with. As long as it builds the habit, you're great. And then as time goes on, you can really play around with how cold you want to take it and how long you want to take each session. So those are the parameters that you can play around with once your body is starting to build resilience, you're starting to adapt and really get used to the cold. I hope today was helpful for you guys. I wanted to keep it short and sweet for you, give you kind of the Cole's notes on cold water therapy. If you have any further questions, please comment them below. Please send me a like and subscribe if you enjoy this content so I can keep it coming. And I look forward to seeing you guys again next week.